Welcome back to my YouTube channel. If you are new to my channel, welcome to Medicalcoding site. Hi, I am Nishaba, a certified medical coder. In this video, we will discuss the destruction codes related to the integumentary system. We will explore how these codes are based on different types of the lesion and how to choose the correct code for each type. Without further delay, let's get started. Destructions means the ablation of benign, premalignant, or malignant tissues by any method with or without curatement, including local anesthesia and not usually requiring closure. The destruction codes in the CPT based on three types of the lesions. It may be benign, premalignant, or malignant lesions. Destruction of premalignant lesions is also known as actinic keratosis is coded based on the number of the lesions. The first lesion should be coded with code 17,000, and each additional lesion up to 14 should be coded with add-on code 17,003. For coding 15 or more pre-malignant lesions, always remember to use a single unit of code 17,004. Don't report 17,004 in conjunction with codes 17,000 or 17,003. For the destruction of benign lesions like seborrheic keratosis and warts, a single unit of code 17,110 is used to treat up to 14 lesions, and a single unit of code 17,111 is for 15 or more lesions. The coding for destruction of malignant lesion is different than for the benign lesion. Use a code from the code range 17,260 to 17,286 for each lesion and select the code based on the location and size of the lesion, not the defect. These codes include local anesthesia and are used for all destruction methods including electrosurgery, cryosurgery, laser treatment, and chemical treatment. A patient is diagnosed with actinic keratosis of the chest and arms. She presents to her physician office for destruction of these lesions. Using cryosurgery, the physician destroys 4 lesions on the right arm, 4 lesions on the left arm, and 4 lesions on the chest. What CPT and ICD 10 codes are reported. Option A with the service code 17,000, 17,003, D49.2. Option B with the service code 17,003 into 19, D48.5. Option C with the service code 17,000, 17,003 into 11, L57.0. Option D with the service code 17,000, 17,003, 17,004, and L57.0. In this scenario, cryosurgery is used for the destruction of actinic keratosis on the 4 lesions of the right arm, 4 lesions on the left forearm, and 4 lesions on the chest. Actinic keratosis is a pre-malignant lesion, so the code is chosen from the code range 17,000 to 70,004. Code selection is based on the number of the lesion destroyed. As in this case, 12 lesions were destroyed. First, we will eliminate the option D with the code 17,004, which is only reported once when 15 or more lesions are removed, and it is not reported with code 17,000 and 17,003. Add-on code 17,003 includes the word each in its description, meaning this code can be reported in units when each lesion is destroyed from the second lesion through the 14th lesion. In this scenario where the 12 lesions were destroyed, code 17,003 should be reported 11 times. On the basis of this rule, we will also eliminate option A and B. Our correct option is option C with the service code 17,000 is for the destruction of first pre-malignant lesion and the add-on code 17,003 into 11 for the remaining 11 lesions. Code 57.0 is for the diagnosis of actinic keratosis. What CPT codes are reported for destruction of 16 pre-malignant lesion and 10 benign lesion using cryosurgery? Option A with the service code 17,000, 17,003 into 2, 17,110. Option B with the service code 17,000, 17,003, 17,004, 17,110. Option C with the service code 17,110, 17,003. Option D with the service code 17,004, 17,110. Cryosurgery is used for the destruction of 16 premalignant and 10 benign lesions. The method selected for destroying benign and premalignant lesions based on the type and number of the lesions destroyed. There were 16 premalignant lesions destroyed. For premalignant lesions, we are directed to the code range 17,000 to 17,004. For coding 15 or more premalignant lesions, always remember we should use the code 17,004 and don't report it in conjunction with 17,000 and 17,003. On the basis of this rule, we will eliminate option A, B, and C having code 17,000 or 17,003. In the option D, code 17,004 is used for the destruction of 16 premalignant lesions. In code 17,110 is for the destruction of 10 benign lesions. What CPT code would best describe treatment of 9 plantar warts removed and 6 flat warts all destroyed with cryosurgery during the same office visit? Option A with the service code 17,110, 17,111 along with modifier 52. Option B with the service code 17,110. Option C with the service code 17,110 and 17,003. Option D with the service code 17,111. Cryosurgery is used for the destruction of 9 platter warts and 6 flat warts. Warts are considered benign lesions and are coded from codes 17,110 and 17,111. On the base of these codes, we will first eliminate option C with the code 17,003, which is used in the case of premalignant lesion. Code 17,110 is used for the destruction of up to 14 lesions. A total of 15 lesions were destroyed by cryosurgery. Code 17,111 represents the destruction of 15 or more lesions. Based on this rule, we will also eliminate option A and B. Therefore, a correct option is option D with the service code 17,111. The patient is diagnosed with superficial basal cell carcinoma of the neck and cheek. After discussion with physician about different treatment options, the patient decides to have these lesions destroyed using cryosurgery. Consent is obtained and the areas are prepped in the sterile fashion. With the use of cryosurgery, the physician destroys the lesion on the neck measuring 2.3 cm and the lesion on the cheek measuring 0.8 cm. What CPT codes are reported? Option A with the service code 17,272, 17,281 along with modifier 51. Option B with the service code 17,273, 17,281 along with modifier 51. Option C with the service code 17,000 and 17,003. Option D with the service code 11,623, 11,641 along with modifier 51. Cryosurgery is used for the destruction of superficial basal cell carcinoma on the neck measuring 2.3 cm and the lesion on the cheek measuring 0.8 cm. Basal cell carcinoma is a malignant lesion in the CPT index code range 17,260 to 17,286 is used for the cryosurgery of the malignant lesion. First, we will eliminate option C, used for the destruction of premalignant lesion. We will also eliminate option D with the codes used for the excision of malignant lesion. Destruction of the malignant lesion code selection is based on location and size. For the neck, a code from the range 17,270 to 17,276 is selected. The neck lesion is 2.3 cm, making 17,273 the correct code. For the cheek, a code from the range 17,280 to 17,286 is selected. The cheek lesion is 0.8 cm, making 17,281 the correct code choice. Modifier 51 is appended to 17,281 to indicate multiple surgeries. So our correct option is option B with the service code 17,273, 17,281 along with modifier 51. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.